Welcome to Mnemonics. Today we'll be learning about systemic lupus erythematosus. By definition, systemic means it affects multiple organs. Lupus is because it's an autoimmune condition, and erythematosus means it causes the reddening of the skin. Systemic lupus erythematosus is a chronic autoimmune disease that affects multiple organ systems through immune complex mediated damage, and it affects different organs in different people, more commonly in females than in males, and the peak pediatric age of diagnosis is 9 to 15 years. The main cause of systemic lupus erythematosus is unknown, though some theories suggest the following factors: the genetic factors, where there's a defect in the complement system, especially the complement protein 3 and 4. Hormonal factors also seem to play a role, in which the studies reveal the interrelation between systemic lupus erythematosus and the hormone estrogen. Immunological factors, and it's seen in the presence of autoimmune antibodies in the body. Environmental factors such as ultraviolet light, drugs such as procainamide, which is used to treat arrhythmias, virus such as EBV, the Epstein virus, and cigarette smoking. The pathophysiology of systemic lupus erythematosus. Due to environmental factors affecting the cell, some may lead to damage of cell DNA. And as cells try to repair itself and fail, the cells will die by apoptosis, a programmed cell death. This will lead to the release of apoptotic bodies, which are fragments of DNA, histone proteins, and cardiolipin. Normally, these bodies are cleared by macrophages and monocytes in a normal individual, but in susceptible ones, the clearance mechanism may be impaired, and these proteins may be recognized as foreign antigens. Sensitizations occur as the dendritic cells capture this antigen through their toll-like receptors and present to the nearby lymph nodes, thereby activating naive T cells to form a number of T helper cells. In case of systemic lupus erythematosus, the naive T cells will be activated to form T helper 2 cells in the presence of interleukin 2. Therefore, T helper 2 cells will induce humoral immune response by promoting the B cell activation and proliferation. Eventually, these B cells become plasma cells and lead the production of antibodies which are reactive against self-antigens. These antibodies will react with normal antigens and form antibody-antigen complex, which induces the complement system via the activation of many enzymes and cause perforation of the membrane lining, which leads to the unwilling in and out movement of materials into the cell, inducing inflammatory reactions which result to cell rupture and death. This kind of tissue damage is due to reactions called type 3 hypersensitivity reaction. Symptoms of systemic lupus erythematosus. The diagnosis of the disease is difficult due to the presence of many symptoms which vary from person to person due to gender and genetic susceptibility. General symptoms include fever, weight loss, joint pain, and rash. With their specific symptoms, this depends on the organ damaged, and these are used to establish 11 criteria for diagnosis of systemic lupus erythematosus, where the patient is diagnosed to have SLE if 4 or more criteria are met. These specific symptoms, according to the organ damage, are as follows. The skin, mostly in sun-exposed areas, where we have the first symptom as MALAR rash. These are rashes on cheeks which spare the nasolabial folds. They are butterfly-like and sometimes are called butterfly rash. Second, we have discoid rash. These are plague-like chronic rashes on sun-exposed areas. The third symptom is photosensitivity, and this is redness that occurs in sun-exposed areas. Mucous membrane, the inner membrane of the tissue, where we have the fourth symptom as ulcer. We have the oral ulcers and the nose ulcers. The serosa, which is the outer membrane of tissue or organ, where we have the fifth symptoms as serositis, and in this we can have the pleuritis, which affects the outer covering of the lung and the chest cavity, and we have pericarditis when the heart is involved. Joints, where we have arthritis, and this may affect two or more joints. With the kidney involved, we have the seventh symptoms as renal disorders, where we have abnormal urine protein and diffuse proliferative glomerulonephritis. The brain, where we have neurological disorders such as seizures and psychosis. The ninth is blood, or where we have the hematologic disorders such as anemia, thrombocytopenia, and leukopenia. With the 10th symptoms, the patient will manifest with immunological disorders, where we have DNA antibodies which act against double-stranded DNA, and Smith antibodies which also act against ribonucleoprotein, and we have phospholipid antibodies, which some include the cardiolipin antibodies that may give false positive for syphilis, the lupus anticoagulant, which in some patients they may present with hypercoagulable disorders, and the B2 glycoprotein 1. With the 11th symptom, we have the nuclear antibodies, which give a very sensitive test, as most patients with systemic lupus erythematosus present or have nuclear antibodies, but it is not very specific since it is also found in some other autoimmune disorders. These criteria are too much to remember, but with mnemonics you just need a soap to wash your brain and read it again so that you can remember all the symptoms. Let's use a mnemonic MD brain soap to remember this. Where we have the M for MALAR rash, D for discoid rash, a B for blood disorders, renal involvement, and nuclear antibodies, immunologic phenomena, and N for neurologic disorders. S for serositis, where we said it presents with pericarditis or pleuritis, oral ulcers, A for arthritis, and P for photosensitivity. Treatment and prevention of systemic lupus erythematosus. Well, with the treatment, the main aim is to prevent the disease or limit its severity. Well, with prevention, avoid sunlight exposure so that to avoid flare-ups and rementers, avoid taking cigarettes, and with limiting severity, the pharmacological drugs are used, where we have the use of corticosteroid, which is used to limit immune response, tacrolimus, which inhibits the interleukin-2 production, myelophelate, and azathioprine, which reduce the lymphocyte activity, where we talk of the B and the T cells, non-steroidal anti-inflammatory drugs, which reduce the musculoskeletal pain by inhibiting the prostaglandin production. And we have the belimumab, which inhibit the B cell stimulation. Celebrities such as Tony Braxton and Selena Gomez also suffer from systemic lupus erythematosus. Thank you so much for listening. Remember to subscribe and like the video, and you're always welcome to Mnemonic Store. Thank you very much.